The most common bacterial infection is the urinary tract infection, also known as a UTI. Indeed, the leading cause of nosocomial infections are UTIs. The use of indwelling urinary catheters is thought to be the most significant risk factor for developing nosocomial urinary tract infections. This is an example of an indwelling urinary catheter. Some other risk factors for UTIs include age, urinary incontinence, increased sexual activity, prostatic hyperplasia, diabetes mellitus, pregnancy, and poor hygiene. The bacterial disease process for this pathology are fecal-associated gram-negative organisms, with Escherichia coli accounting for about 80% of urinary tract pathogens. Staphylococcus saprophyticus causes 5% to 15% of UTIs, while Enterococci, Klebsiella, and Proteus make up the remaining common organisms. One of the initial decisive events leading to UTI is the vaginal colonization by virulent uropathogens. For the most part, these organisms originate from the woman's own intestine via the rectal area. This is an example of how a woman can contract a UTI. By wiping back to front, she will transport the E. coli from the rectum into the urinary bladder. So therefore, women should wipe front to back to prevent disease. The most common route of entry of bacteria into the urinary tract is ascending up the urethra into the bladder. Although infrequent in occurrence, infections may be bloodborne or acquired via the lymphatic system. The diagnosis of a UTI is typically based on history and urinalysis results. A bacterial count of greater than 100,000 organisms per milliliter of urine is commonly accepted criterion for diagnosis. Besides the bacterial count, the urine leukocytes count is more than 10 leukocytes per cubic milliliter of urine collected midstream, and the presence of leukocyte esterase and nitrates and protein are also helpful. Many people demonstrate pyuria, leukocytes in the urine, without infection. And corroborating clinical and laboratory information must be evident to diagnose an infection. This is the process used for urinalysis. Anyone can contract a UTI, but women have the greatest risk. Urinary tract infections affect nearly 13 million women annually in the United States alone, and can result in significant costs and morbidity. The urethra in females is shorter compared to that in males, and also close to the entrances to the vagina and the rectum. UTIs affect children, involving approximately 7% of girls and 2% of boys before the ages of 6 years. UTIs are more common with the elderly. The incidence for them is 25% for women and 20% for men. Regarding the prognosis of UTIs, most of the episodes are either asymptomatic or produce minor sequelae due to the spread of infection. Contiguous organs can be affected. 2 to 4% of the cases may develop life-threatening septicemia. In pregnant women infected with UTIs, more than 1.9% of pregnancies result in fetal death. In clients who are healthy and without complicating features, empiric treatment with antibiotics is effective and urine cultures are not required. Acute UTIs in healthy, non-pregnant clients are typically treated with antibiotics, such as fluoroquinolone. Current guidelines on the management of urinary tract infection recommend treating febrile urinary tract infections or acute pyelonephritis with antimicrobials for at least 14 days. Physical therapists become involved due to the impairments, functional limitations, and disabilities associated with the UTI. Restrictions are commonly found in people with interstitial cystitis involving the muscles that attach to the pelvis. An impairment associated with a UTI is limited range of motion due to pelvic restriction, decreased ambulation due to the limited range of motion of the pelvic muscles is an example of a functional limitation involved with UTIs. An example of a disability that has derived from the infection is due to decreased ambulation. Home management is also impaired. Specific passive and muscle reeducation activities are progressed according to the individual's response to soft tissue interventions. Modalities such as biofeedback and ultrasound and electrical stimulation may be employed. Depending on the severity of infection, a person with a UTI may not be able to participate fully in a rehabilitation program until the disease is brought under control. A crucial aspect of evaluation and intervention is the condition of soft tissue, especially in the lower extremities. Early screening and detection is necessary in reducing damage caused by this disease. In conclusion, it is important that one is knowledgeable of pathologies and their disease process in order to prevent them.